Hi all, welcome. This is 92.7 Big FM PK Khada. So today we have Dr. Bhargava Reddy garu. He will explain us about the kidney problems, kidney stone problems, renal problems, renal calculi అంటారు. దాని గురించి మనకి ఎగ్జాక్ట్ గా తెలియదు. సార్ మనకి దాని గురించి ఫుల్ ఇన్ డెప్త్ నాలెడ్జ్ ఇస్తారనమాట. చాలా మంది దీనికి సంబంధించి ప్రాబ్లమ్స్ ఫేస్ చేస్తున్నారు. We all know. So sir, let's start. Firstly, sir, we want to ask you before this kidney problem. COVID ఎలా ఉంది పరిస్థితి బయట? ఇప్పుడు ఎలా ఉంది? ఎలా ఉండబోతుంది? మీకు ఎలా అనిపిస్తుంది అసలు?
Good evening, listeners. This is Dr. Bhargava. I am from Sunshine Hospitals, Gachibowli. I am urologist and andrologist and practice. I have a special interest in endourology, that is treatment of the renal stones and related complications. And today I'm going to elaborate and have certain information I'm going to share with you all listeners. Thanks to giving me this opportunity for 92.5.
92.7 Big FM.
Sorry. you can edit?
No problem. Yes, we can edit.
Okay, that's good. Yeah. Yes, regarding COVID-19, yes, we have some good news for the listeners. Yes, we are slowly, the case load in India is coming down, and the recovery rate is very good. And overall, I can say it's I can see a light at the end of the tunnel. That's what I can say you. And let's say what we can say is within no time we are going to conquer that. And at the same time, we should not take it lightly. Whatever the measures we are going to take all these days, we have to continue that. That means we have to make ourselves protected from the group, and at the same time we should not be a source for the other infection. We have to wear masks. Of course, I am presently in alone in the room, so I am not wearing a mask. When you are going to a group, you have to wear a mask, and you have to make yourself very comfortable with your surroundings. Okay, and you should make hands hygiene, and you are not supposed to touch your face and all. That is the only preventive aspects what you can do from your side. Rest you have to leave it to your doctors. They will take care of the things. And here today I'm going to talk about renal stones, that is also called as renal calculi. You can ask your questions so that I can share you whatever the information I can have, and at the same time what are the preventive aspects, what are the options what we have, and how we can help you, and what are the types of the stone, what are the medications, what are the preventive aspects. All these things I can share.
Yes, doctor, I have prepared set of questions for you. So firstly, we want to understand what is renal stone or what is renal calculi, sir.
Yes, renal calculi is small concretions, that means small crystals which are formed in the kidney. And once this is a kidney, if you can see it, this is a kidney, and these are the different types of the calculi. These are the small concretions which form inside the kidney. When you cut the kidney half, this is how it looks like, and these are the areas which they form. I can say, I'll give a small example.
Yes,
see, if you observe the tap in your house, when the tap is running, and if you put it, there will be a concretions formation at the tip of the tap. Same happens. These are the filters in the kidney which usually filter the blood and urine. It has to go like this. Over a period of time, the stone form, that concretions form here, and when it dislodge, it blocks the kidney. Okay, this is called renal stones. These are the different types of the stone, and I'll come to that next in coming questions. And that is called renal calculi and nephrolithiasis also, we call it in a medical terminology. Yes.
Okay, what is the prevalence of renal calculi, doctor?
See, normally worldwide prevalence is between 2 to 20%, and in India I can say we are ranging between around 10 to 15%. Particularly, it's very common in summer days. And there are certain stone belts in India. For example, as we are residing in Telangana, Ramagundam is one of the very common, Nalgonda. These are the very common areas where you see very commonly see this sort of patients, renal stone diseases patients. And because of that humidity, because of that hot temperatures, they easily lose the water quantity through perspiration, and they will be dehydrated and they form a stone. That's how the stone forms actually. And it is, I can say it is around 10 to 15%. That is the prevalence in India.
What are the risk factors of this renal calculi, doctor?
Yes, there are certain risk factors. Actually, I can say it runs in families also, and personal level, it is like the person who is working in hot, humid temperatures, like jobs. I can say the person who is working in what call
Deserts or something.
furnaces,
Oh,
or some sort of minings,
fine.
coal
Yes.
industry, or some sort of heavy radiation,
Chefs
like
also will have this problem,
yes,
doctor.
yes, of course, yes, of course. Who exposes to particularly more of heat, and those work in very humid conditions, they'll have a high prevalence. And those who take who binge on particular animal protein, I cannot name it, of course. Yes, I can see in particularly a Muslim population, they take a lot of animal protein, so they have a very high incidence of stone disease, particularly animal protein, what I can say. And those who take very less intake of water, and those, as I said, very it runs in families. Those who take less fiber diet, less vegetable, these are the common people who get the stone disease.
Okay. What are the symptoms, doctor? What are the symptoms? How will we know that this is?
There are a few symptoms like usually they present with when it is obstructed. Stone, as it is present in the kidney, won't give you some symptom like pain or something like that. When it comes to the ureter, that is a pipe which connecting the bladder to the kidney. When it blocks the ureter, you will have pain, burning urination, vomitings,
Um,
and some sort of renal failure. These are the fever. These are the symptoms usually they present with. Simple stone which is very small in the kidney won't per se cause the uh, mm, pain. Okay, they are asymptomatic most of the time. I can say you like this. There are if you scan around 100 people in the population, usually 10 to 15% of them will be having a stones. In
okay.
the 10 to 15 also, all are not symptomatic. Symptomatic in the sense they won't have any symptom, like they won't have any pain, they won't have any issues with that stone. They will be having very small, which are non-obstructive. When it blocks the system, that passage of the urine, then they will have pain, fever, vomitings. These are the usual complaints.
How are they actually formed, doctor? How do they form? Matlab, uh,
That's what the reason behind is, as I said, the dehydration. See,
dehydration. Okay.
when you having more of like animal protein, they where
Okay.
they are having a rich uric acid, more like oxalate rich food. If you take, they will be precipitate like small crystals. They will like form together, a form small stone.
Okay. Doctor, I heard that people who eat more tomatoes, more palakura, will
Yeah,
get
yeah.
this too.
Palak, tomatoes. These are the foods having high oxalates. So if you binge on them, like having more spinach, more tomato ketchups, and these sort of like more salts, they'll be more prone for the stone disease.
Okay, 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 okay.
Usually, usual intake something once in blue moon day. Usually, we won't take that. We won't binge on that much of palak. Of course, North Indians they eat little, but still, if you take good amount of water, we can overcome that sort of problems.
Okay. How is this diagnosed, doctor? How is this problem diagnosed?
Diagnose. See, basically, patient presents with, as I said, some symptoms like pain, fever, decreased output, urinary output, burning. See, accordingly that we take first general physical examination. If the patient is having what sort of complaint, where is the pain, is he having any fever, and apart from that we get certain modalities like ultrasound, X-ray, urine culture, and CT scan. CT scan nowadays is called gold standard. With that we can get 100% of accurate diagnosis. Where is the stone? How big?
Okay.
What is the complication it is caused, and how we are going to tackle with that? All these sort of information can be obtained with CT scan.
Is this spontaneous, doctor? Like, what do you say? Can this pass spontaneously? Can this
As I
problem?
said before, yes. See, passage. See, stones form here.
Okay.
Okay, it has to go through this.
Okay.
Okay, if the size of the stone is less than 4 mm, it
Okay.
passes spontaneously.
Oh,
Okay, why? Because the size of the ureter should accommodate the stone.
yes.
Okay, mostly the size of the ureter will be around 4 or 5 mm. So the stones which possible is are 4 or 5 mm only. Mostly there are certain instances where the patient comes with a 1 centimeter stone also. Sir, I have passed this stone. You, as you said, only 4 mm can be possible. Yes, miracles happen sometimes.
Well said, doctor. So, what are the factors that can affect the management of renal calculi?
Yes, as a stone per se cannot have any symptom. If it is blocking or some sort of infection, some sort of like a renal failure, if they present with like a fever, we have to control that infection and manage accordingly. If the stone is blocking and it is in the kidney, there are certain mechanisms called blasting the stone like ESWL, RIRS, PCNL. These are the modalities where we can treat the stones. If the stone is in the ureter, we have to do URSL or RIRS, whatever the
Yeah, yeah.
procedure.
Please explain about that, doctor. Please explain about the diagnosis procedure of this.
I mean to say management of renal calculi.
Yes, yes.
Yes,
So,
the modalities what now we are like following is PCNL, percutaneous nephrolithotomy. It is putting a scope inside the kidney and puncturing the kidney and removing the stone. That is called PCNL. If the stone is approached through the urine passage, then we call it as like URSL or RIRS, depending on the energy modality what we use. See, we approach the stone through the urine passage and we reach there and we blast the stone with a energy source, something like laser or lithotripsy or whatever it is. Okay,
will it be
that
very painful, doctor, that procedure?
we usually anesthetize the patient, and patient won't have any pain. It is
Okay.
absolutely pain-free procedures. Yes, we do the procedures under anesthesia.
How much time will it take to come out of this problem, doctor? If somebody faces this problem,
Usually, these procedures are becoming nowadays daycare procedures. Of course, a day and hospitalization is a mandatory, of course, and
okay.
it's a safe practice to be there in
Within
hospital.
1 or 2 days, they'll come out of it, doctor.
Yes, absolutely, absolutely. Olden days, they used to open the kidney and do the remove the stones. Now it becomes like more sophisticated. So a small laparoscopic incision or through lasers, we are doing it.
Okay. Thank you, doctor. What are the general measures that can be taken to prevent this recurrent stone?
Yeah. See, as I said before, certain foods you should avoid. High animal protein like red
Yes.
meat, you have to take avoid taking, and more amount of water. Minimum of 2.5 to 3 liters of water should be taken, particularly in a sunny days, like something like summer days. And
Okay.
restrict. You have to restrict salt less than 50 millimoles per day, less than tablespoon. Okay, that is salt. You have to cut down. You have to make sure that your food will be supplemented with adequate fresh vegetables. In that particularly, you can avoid certain oxalate rich food like spinach And particularly you should avoid nuts. You should avoid nuts like badam. Having a more nuts is also stone forming. Chocolates, who are fond of chocolates, I think you look like for having more chocolate. That should be avoided. And certain fruits are more helpful in preventing citrus
Life
type
is
of
so
fruits are
confusing,
more
doctor.
prevent.
People say eat this for good health, and if we eat that, we will get some other problem.
I know, I can understand. Every thing has every certain positives, negatives.
Yes.
Every measure what you take, everything has its own merits and demerits. And if you take more of cranberry juice, you can avoid particularly stones. These are the simple measures you can take to prevent stones.
Thank you, doctor. Thank you so much for giving your time. Any message you want to give it to our listeners in particular?
Yes, stay healthy, keep healthy, and please follow the COVID norms to safeguard you and your family. Thanks for the 92.7 Radio FM to give this opportunity. And this is Dr. Bhargav from Sunshine Hospitals.
Thank you, doctor. And finally, I want to say something. We have something called gift of music.
Okay,
Okay.
thank you.
So what we do here is, uh, you can do one thing, doctor. You can record your voice, go
Mhm,
to Instagram,
mhm,
type Big FM Telugu. There
mhm.
you can record your voice and just drop it. Whatever message you want to give it to your loved ones, your family, your anybody, whatever message you
Okay.
want to give, just record there and drop it. We will play it in the radio and we will play the song what you want. That is a
Oh,
gift of music what we do.
thank you. Thank you.
Please
I'll
try
do it.
that whenever you get time.
Thank you.
Thank you.
Thank you.
Have a great
Thank
day, doctor.
thank you.
92.7